All right, we can start.
Okay. Well, thank you everyone for joining us for this very first of our three-part series. The Holland Human Relations Commission decided to host this series to sort of lean into this Fair Housing Month and to hopefully share with the community some new information around housing and homelessness in our community, and also to learn from a lot of the agencies and organizations that are doing the work here locally. Today, we have the pleasure to have as our guest, Lynn Raymond. A lot of you will know Lynn as one of our city council members, but Lynn also serves as the director of the Lakeshore Housing Alliance. And I'm just gonna read Lynn's bio really quickly here because I think it says a lot about what her passions are and what she has spent her life work doing. Lynn first came to Holland from the East Coast to attend Hope College. After graduating with degrees in psychology and Spanish, she taught Spanish for 3 years until she began service in community development around the US and abroad. She worked with refugees on the Texas border with a human rights organization in Washington, DC, with women artisans in Guatemala and Mexico. And she returned to Holland 20 years ago and is now the director of the Lakeshore Housing Alliance, a program of the Greater Ottawa County United Way, a group that works collaboratively to meet the needs of people experiencing homelessness. She lives in the center city of Holland with her husband, Larry, and their dog, Bo. She was elected to the city council in November of 2019, and she has been a volunteer in the city of Holland for the last several years, first joining the Neighborhood Improvement Committee, and then was appointed to the Planning Commission. She's an ally in the Circles program, an initiative that brings people of diverse incomes together to help low-income individuals and families achieve their financial goals. I think Lynn's bio says it well, that she has really invested herself in the lives of individuals in our community. And so we are thankful to have her and her expertise here today to share with us a little bit about our first topic, which is around homelessness. So a couple of reminders to everyone as you are joining us. Please just make sure that you have your microphone muted. And then if you have questions as we go along, feel free to drop them in the chat box. And I will be looking at those questions and we'll be trying to ask those questions of Lynn as we go along, but we will also take some time at the end of our time together to answer some of the questions. We hope to be done right at 1 o'clock, as this is kind of that lunch hour of Zoom and Learn. And so we'll try to keep ourselves kind of limited to that. Please also know that we are recording these sessions and they will be posted on the Human Relations Commission's Facebook page, you'll be able to access them there as well and share them out with everyone else. So Lynn, thank you so much for joining us today. And I want to just kind of start off with asking you, can you just share the mission and purpose of Lakeshore Housing Alliance?
Thank you so much, Rebecca, and thank you to Esther at the City of Holland for sponsoring, the Human Relations Commission for sponsoring this series of information about homelessness and housing in the Holland area. And I thank you for reading that bio. It was so interesting to hear that again. And I realized that for all you dog lovers out there, we actually lost our dog Bo in August, which was of course terribly sad, but we have a new little COVID puppy that's keeping us busy. So we're happy to have her in our home. Yeah, so fortunately, Rebecca and I had an opportunity to talk a little bit ahead of time. So I do have some slides to share as we're talking through some of the questions that might be of interest to you. So the Lakeshore Housing Alliance has actually been around for quite some time. Back in the late 1990s, the Department of Housing and Urban Development of the federal government required all communities that receive funding from HUD for homeless services. HUD required us to organize ourselves into a collaboration of housing providers in order to facilitate the distribution of the funds that we were getting into our community. And so initially, these continuums of care that they're called, COCs, were organized essentially to distribute funding and to do that in a collaborative manner. Over the course of the last 25 years, that has evolved into not only facilitating the distribution of more and more funding, but to also create a plan to end homelessness. And so our responsibility has grown over the course of those years to really make sure that the programming that we're creating is meeting the needs of the people in our community. You see our mission statement on the screen, and this has had a couple of iterations over the course of my time with the Lakeshore Housing Alliance, which has been about 15 years. We recently, about a year ago, we took a look at our mission statement and realized that we weren't really, and we were addressing the needs of people experiencing homelessness, but we were also addressing the needs of people at risk of homelessness. Prevention has always been a really important part of the work of the member agencies of the Lakeshore Housing Alliance. And I should also mention that the Lakeshore Housing Alliance is made up of about 26 to 30 agencies in the community that provide a variety of housing programs, supportive services, and actual housing opportunities. Our meetings are open to the public, and you can just contact me, and my information will be available to you at the end of our session. And I would also like to note that the Lakeshore Housing Alliance is responsible on a regular year, is responsible for distributing about $1.5 million to agencies in the community that provide permanent supportive housing, rapid rehousing, street outreach, as well as homelessness prevention. So that's kind of a quick explanation of what the Lakeshore Housing Alliance was created to do.
Thank you. And that kind of growth that you are sort of alluding to, right? That moving from just simply kind of, I would say, a red tape rubber stamp to sort of this collaborative effort over the years is a really fascinating thing that we want to dig a little bit deeper into. But as you look at this kind of the 26 to 30 agencies, it seems like you guys have a collective kind of understanding or definition of homelessness. How do you define homelessness?
Well, that's kind of that's like an easy question and a really, really hard question. Because we receive so much, well, I won't say because we receive so much funding. Fortunately, the funding that we receive from the state of Michigan and from the federal government really aligns with our priorities of wanting to move people into permanent housing as quickly as possible. And certainly,
hold on, Lynn, you are muted. Just one moment. There you go. Why don't, if you can unmute yourself again, sorry. And maybe back up just a little bit for us on what you were saying.
Sure. Did I do that or did somebody do that?
No, I think
Okay.
we just, yep, Esther just made a quick mistake on that one, so it's all right. Yep.
I wasn't sure if I touched a button or something. Yeah, so we follow the HUD definition of homelessness because it's required by our funding for sure, but the funding we receive also really represents our priorities of providing permanent housing as quickly as possible to people who are experiencing homelessness. And so the short definition is the one you read on the screen. However, several years ago, the Department of Housing and Urban Development expanded the definition of homelessness to be much more broad, to include categories for youth, people experiencing domestic violence, broadening the definition of chronic homelessness. And so it really incorporated many more people who are considered most in need. So that was really, really helpful in our ability to serve more people and having more people eligible for our services. And with that, I mean, that said, we certainly recognize that the people who are living in shelter or on the street are certainly the most in need of housing, but we also recognize that there are people, especially now, who are living doubled up with family and friends, who couch surf, and who don't have a fixed place to stay, but may not meet our HUD definition of homelessness. And so, you know, as we're talking, Rebecca, I think we'll talk a bit about the challenges that we face in making sure that we meet the needs of everybody who needs housing security. And so that's that sort of gray area we land in. We certainly have the required definition of homelessness, but we also recognize that there's a broader population of people in need out there.
Yeah, and I think your sort of use there of the word housing security probably is a really important one as we sort of continue that conversation, right? That sort of space for a lot of individuals in our community who maybe are feeling insecure in their home housing situations, and how that kind of fits and navigates in with some of the challenges that you are talking about. As you sort of look at this, how many individuals would you say or how many individuals are you and your organization classifying currently as homeless in the Holland area? And how do you count these individuals?
So the Lakeshore Housing Alliance is really lucky to be a part of a collaboration with the Michigan Coalition Against Homelessness. One of the things that HUD also requires of us is that we use a homeless management information system, a web-based system of tracking people and services provided to people experiencing homelessness and who are at risk of homelessness. And the Michigan Coalition Against Homelessness is a great partner in helping us set up a really robust and accurate database. And so all of the organizations in the county that provide housing, well, the vast majority of organizations that provide housing to people who meet that HUD definition of homelessness enter data into our homeless management information system. And so anytime data comes from the Lakeshore Housing Alliance, it's going to come from that database. And we work together and we collaborate not only to make sure that data is entered, but together we talk about that data and do analysis and make sure that the community is constantly educated on our progress, because that's one of the things that we use data for, is to be able to track our progress and whether or not the programs that we're providing are actually meeting needs. So the homeless management information system is the key way that we track people experiencing homelessness. You asked about currently. At the end of January every year, we do a point in time count, which kind of gives us a snapshot of how many people are experiencing homelessness in Ottawa County on that one night in the middle of winter. And this year, it's not surprisingly, actually, the number was significantly lower than it was last year. We confirmed that there were about 124 people who were living in emergency shelter, transitional housing. And this year we did not do a separate, because of COVID restrictions, we did not do a separate count of people who were living on the streets. So we imagined that it was going to be lower because many of the organizations had to limit the number of people they could serve in their programming because of the social distancing guidelines and those kinds of things. So so while that is it seems like it's great that the number has gone down. We imagine that that number is not reflective of what is actually happening. And so over the course of the 2 previous years, we were at that point in time at 225 and 226. So I imagine that we're at a normal year, it would have been something similar to that. And what you're seeing on the screen is just our, we also gather all of our annual data. And so you can see on the screen our annual data over the last 3 years, again, drawn from that, what we call HMIS system. And again, it's trending down. 2020 was lower, not surprisingly again, but we are looking forward to seeing what it will look like next year to see where that trend is. We're reluctant to say this is a trend because last year was really an anomaly. However, I will note that you'll see that the number of seniors on the far part of the screen is going up, or at least not changing that much. And that tracks with the data across Michigan, that the number of homeless seniors is increasing. And so that's something that we're trying to keep an eye on.
So Lynn, you mentioned, that January point in time count that you did, that you only were really looking at emergency shelter numbers at that point in time. Have there been more recent counts in in that homelessness, whether it's in tent camps or tent cities, maybe around Holland? Have there been more recent counts as far as you know, or is that something that individual organizations are really looking at?
Well, individual organizations are certainly looking at that, in particular Community Action House and their incredibly effective street outreach team keeps an eye on people who are living unsheltered on a regular basis. And they see over the course of the last year or so, over 100 people they have connected with with a quick meeting to 6 months of supportive services for folks who are living unsheltered. So Community Action House absolutely has a handle on how many people are living unsheltered in the community.
Okay, thank you. Thank you
Yeah.
for that. What are some of the reasons that you guys are seeing as far as why individuals here locally are experiencing homelessness? I'm sure there's kind of some national trends, but what are some of the reasons that you're sort of seeing here locally as for those reasons?
Well, I think that the local reasons are the same as the national reasons. People are homeless here for a lot of the same reasons that we're seeing across the country. There's a lack of housing stock, which contributes to homelessness. The lack of stock also increases the price of housing, which is exacerbated because of low income and or a lack of income makes it difficult to afford housing. Many households are simply one emergency away from homelessness. And that emergency is often related to health concerns. Mental health and substance abuse are often the cause of homelessness, and that really points locally to needing more access to permanent supportive housing in order to meet the needs of people who have disabilities like mental illness or substance abuse. 21% of people who identified as homeless at some point in 2020 reported a recent experience of domestic violence. That's a very common reason for homelessness. And fortunately, we have a really quality organization in the community that addresses the needs in resilience. They address the needs of people who have histories of domestic violence. And finally, we know there's a historic inequity in housing throughout the country. Ottawa County is likely no exception. The LHA has embarked on a study we're studying program provision and outcomes as they relate to race and ethnicity. we want to be sure that our programming is equitably distributed and that programming is designed to meet the needs of everyone. So that's one thing that we're working on, at our meetings and at our regular bi-monthly meetings.
Yeah, thank you. Yeah, so kind of that top number, right, with the housing stock, that's probably gotten a lot of attention here, I would say locally in Holland, this idea of the struggle to find housing stock. And I want to come back to that conversation a little bit when we talk about sort of the mission of LHA around permanent housing first. But in just shifting kind of that understanding for just a moment, because I think we are in a unique spot right now, right, with the pandemic. How have you and your organizations seen the pandemic really impact homelessness in the area?
In thinking about this, I realized that the pandemic changed everything and nothing, because the LHA member agencies immediately got to work answering the question, how do we serve the people? How do we serve the people safely? Every single organization that addressed the needs of people experiencing homelessness shifted their strategies and modified their processes in order to ensure safety for their staff and for the people that they serve. Good Samaritan Ministries created strategies so that people could be screened over the phone and safely in the office when needed, and established other protocols for their eviction diversion program in order to ensure safety. Community House kicked into gear right away, making sure that food was distributed effectively, and their street outreach team continued right from day one to connect with people at their refresh ministries over at First United Methodist Church. Resilience and the Holland Rescue Mission, organizations that have emergency shelter, created protocols with the help of the Department of Health and the Ottawa County Department of Public Health to create protocols to keep their people safe. They didn't miss a beat. Honestly, they just kept working, and they continued to do the work of housing people over the course of the last now more than a year, which is really quite amazing. Yeah.
You kind of mentioned, though, that one of the struggles with and looking at the numbers of individuals living in shelters in your point in time, that was lower than in 2020, and you alluded to that kind of that space right now where it's probably both the protocols in place in our organizations that have to limit sort of the numbers of individuals who can be present. And maybe also some of the fear to live in communal living spaces that might exist. How have you seen kind of that impact with the pandemic on potentially maybe I would say potentially the increase of individuals who might be living on the streets?
Well, I think what we can speculate is that people stayed put to a point if they were living with family or friends, or if they were even if they were living unsheltered, they felt safe in the communities that they had created, rather than joining a congregate setting. So I think that broadly speaking, we could say that we could speculate that that's what happened. Also, while the numbers in particular places might have had to decrease based on social distancing guidelines, the community as a whole really worked hard to make sure that there were alternate settings in the case that there were people who needed housing or wanted housing, and there wasn't space locally because of the social distancing guidelines. So local businesses, hotels provided an additional space for people who were looking for emergency shelter. And I know even for months after, Resilience was using an alternate space for the folks who were coming to their organization for shelter. So we did the best we could to make sure that we were providing housing when it was needed.
Yeah. Well, thank you. And I think one of the things that I'm taking away from what you're saying, Lynn, is that sort of that collaborative space that you have created within the multiple organizations allowed sort of this quick shift in approach in order to meet people's needs the best that we could during this time. And that I think is a real testament to sort of how the organizations have been working collaboratively. As you sort of think about this though, one of the things that you've mentioned to me in some of our conversations is that Lakeshore Housing Alliance has a housing first or a permanent housing first kind of approach. Why do you sort of believe in this kind of philosophy or approach is the best? And what are some of the kind of like, let's say big challenges that you're finding with this approach right now?
So the model is exactly as you say, housing first, and it is exactly as it's described. We want to be able to provide housing and then surround people with supportive services. And the reason that we feel, I mean, besides that there's data and research that indicates that housing first is a model that works, most people experiencing homelessness are seeking a permanent place to call home. They want a place to lay their head. Where they can be safe and healthy. Several years ago, we started focusing on determining the best fit for the housing need. And good Sam likes to say, to right size the assistance. If a family needed a couple of months of back rent and a couple of months going forward, and then they would be stabilized, then that's what we wanted to provide. If an individual had a long-term disability, that would make it impossible for her to earn an income, then let's target permanent supportive housing for that individual, rather than having her move through a series of program types that wouldn't stabilize her. So the use of a vulnerability index that we've been using, or a sort of a vulnerability assessment that we've been using, really helps the individual identify where they land on the continuum of housing types, so that we can target that and make sure that whatever choice is available to them, it's long-term. Really, collaboration is the key to ensuring that strategy is successful. Emergency shelter and other interim housing opportunities really are important to bridging the time between the identification of the need for housing and finding housing. So that's a really important piece of the puzzle. And I think you asked about challenges. That there are challenges to any approach to ending homelessness. Enough housing options. We've already talked about stock a little bit. Enough landlords willing to participate in housing programs. And then some individuals really have extensive barriers to housing that can be difficult to overcome. And while there are paths to permanent housing for many seeking stability, the paths get murky for those who have really high barriers. So that's definitely one of the gaps that we see in our services. There is, I keep talking. Did you want to ask something else?
No, I was just going to follow it up. Like, what are some of those, when you name kind of big barriers in that sense for individuals who have maybe more barriers, can you sort of explain a little bit more what you mean by that?
Well, I think it could be anything from a history of eviction that landlords would reject and on the basis of evictions, to mental health challenges, to lack of income, to really people who have been homeless for a very long time have difficulty transitioning into stable housing. So all of those are challenges for the individual and for us to make sure that we're meeting those needs and making sure that they know the resources that are available to them.
Which, it sounds to me, and we will talk to some of these organizations, next week, but it sounds to me like that collaborative kind of wraparound services that Lakeshore Housing Alliance kind of helps to coordinate and kind of foster, that's why this is so important, because there's such a unique sort of story behind every individual who is either at risk of experiencing instability in housing or who is experiencing homelessness. How are you seeing kind of that collaborative approach right now sort of really paying off? I mean, you've mentioned a few things already, but how are you kind of seeing some of that collaboration really paying off right now?
Well, we have a so Ottawa County has always been collaborative. I guess how I want to say is, and for many, collaborative and cooperative. And I see there's a little bit of a difference. Like when I think about the LHA and the organizations that make up the LHA, we've always been cooperative and communicative and able to have conversations with each other. I think the way that our cooperation translated to collaboration over the course of several years really, I think, is manifesting itself in our response to the pandemic, for sure. But also, one example is our what we call the Interagency Services Team, which is a group of housing providers, people who have housing available that can be provided to people who have high barriers. And with the express permission of those individuals, we can have a conversation together about where the best opportunity is for that individual based on the needs they have expressed. And that's been enormously successful in housing dozens of people over the last year or so. And I think it's just a great example of how when we sit around and put our collective brains together, we can come up with solutions for people. It is one person at a time, but when we celebrate the housing of an individual and then we're looking at a dozen individuals at once, we celebrate somebody getting housed and we begin focusing on somebody else. So that's been really gratifying to see how we work together with that.
Yeah, and I love that image of many brains kind of coming around the table together who are passionate about this, and yet we know, right, Lynn, that there are still individuals in our community who are experiencing homelessness, and so we know that we haven't, I would say, like won the battle against homelessness yet. And one of the things that I'm kind of wondering right now is like what gaps or sort of challenges, I mean, we've named kind of the housing stock, we've named some of those things, but where do you see some of the gaps right now? And that you are kind of thinking like we need to really talk about this piece of it right now, or this should be one of our big focus areas right now.
Well, I think I've already mentioned the biggest gap, which is that pathway for people with high barriers. How do we clear that path for people with high barriers to ensure that there is a path to stable housing? So yeah, I think, and again, this is something that has become quite clear and very enormously helpful. The work of the Community Action House Street Outreach Team has really given us an education on we recognize that there are people living unsheltered. What they help us with is to determine, or to be able to see how each individual is different and what they're facing and the challenges that they're facing and what it is that's going to meet their need best. And so they've really helped the LHA to identify that as a gap.
And you mentioned that one of those barriers too is mental health in particular. And we know kind of nationwide, we have kind of, I would say, shortages in mental health resources for individuals. How are you seeing both kind of that challenge being addressed right now within your organization, and maybe even some of the ways that you're hoping to see that continue to grow?
Well, I can tell you how it's being addressed. I'm not an expert in mental health services, so I'm not sure that I could speak too deeply about it. But community mental health is a member of the Lakeshore Housing Alliance, and not only do they provide mental health services, they sit on our interagency services team because they also have housing, permanent supportive housing, and so we're very grateful to have that resource for people who have mental illness, and make sure that that folks who are experiencing those kinds of challenges are referred and able to connect with community mental health, and they're really valuable services to the community. We do circle back to housing stock and how difficult it is for people to actually find housing right now. So that is a constant challenge, and I know that it's being addressed at levels through different paths than the Lakeshore Housing Alliance. While we certainly advocate and support any kind of development of housing and affordable housing in particular, it isn't our focus, but we know that we can't end homelessness if we don't have housing.
Yeah.
Yeah.
And I think that's an issue, obviously, that you are addressing with kind of two hats on, right? Both as kind of the city council and in your role as the director of LHA. And I'm going to ask you for just a moment to wear both of those hats again, because I know there's been a lot of conversation around kind of like tent cities and where the tent cities are and where individuals live. And I'm wondering if you can share with us kind of like, where are the tent cities, or kind of what's your organization's approach to maybe even keeping the privacy of these tent cities, and then why would that be important and or not important? And then also kind of does the city, kind of your other hat, how does the city interact with these communities?
Yeah, so I'm actually just going to answer that question on with my Lakeshore Housing Alliance hat. So,
yeah.
And I'd like to address the second part of your question, because I think that's really the most important one. How do we maintain the of every individual we encounter? And so the LHA member organizations who work directly with people experiencing homelessness or who are at risk of losing their homes, whether they're living in a tent or emergency shelter or in an apartment, the information related to their situation is shared only with the individual's express permission. So if I knew where they were, I wouldn't say. And our local street outreach team, the Community Action House Street Outreach team, is careful to build relationships, understanding the precariousness of people living unsheltered, and really their desire to maintain some semblance of control over their situation. So wherever a person is living, it's their home, and it's their story to tell, not ours. So that's our, confidentiality of the people we serve is paramount for all of the organizations of the Lakeshore Housing Alliance.
Thank you. Yeah. I know you don't necessarily want to wear the city council hat on this one, but there's been kind of some media attention around some ideas that somehow the city is trying to vacate some of these properties. Do you, from what you understand or even know, is that even something that is happening or could be happening?
I'm not aware of any. I'm not aware of any encampment that is within the city of Holland that's being disbanded by the city of Holland. That isn't happening.
Okay, thank you. If individuals were maybe struggling with housing insecurity or homelessness, where would you direct them to, kind of their first point of contact? Where should they go first to get resources?
Now, the first point of contact is always Good Samaritan Ministries. They're our housing assessment and resource agency, and that is, and at this point, it's the housing assessment and resource agency on steroids, because while they were receiving funds from HUD and from MISHDA to provide the services like homelessness prevention and rapid rehousing and some permanent supportive housing, over the course of the last year, they've also been given millions and millions of dollars to provide eviction diversion. And so, and that is broadly available to the community. I won't get into eligibility guidelines. They can do that next week when you chat with them, but the HARA is, that's what we call it, the HARA. They are always your first call if you are in housing, if your housing is insecure.
Okay, thank you. So Good Samaritan Ministries is kind of that first gateway into resources and services. We're going to transition here in just a moment into any questions that anyone out there might have still. And so if you do have questions, feel free to drop them in the chat box and we will answer them. But Lynn, is there anything else that you feel like that we haven't covered yet that you wanted to address?
I don't think so.
Okay.
I don't think so. I was hoping that for the opportunity to just share. So just to share an example of collaboration. Mm-hmm. We've been talking a bit about people with high barriers and the murky path to housing stability for them. And for so many for some people in those situations, it can really take years of requiring persistence and an enormous amount of social support. And I can think of one individual, and I've been in the housing arena since probably 2000, when I actually started at Community Action House. And I've been doing housing since, for many years. And this individual, even I knew back then. So he's been involved in housing programs that spanned really more than a decade, probably 15 years. And I talked a bit about our cooperation versus collaboration. And I think this individual is a perfect example of that cooperation, in that we all knew that this individual was looking for housing and looking for stability, but we weren't sitting around a table and saying, how do we provide for this individual? And it was the creation, I think, of the interagency services team and the 6 or 8 of us that sat around the table and said, what does he need and who has it? And really being able to talk about that and ultimately finding housing that met his need and being able to provide him with an enormous amount of social support in the community. And I always tell the story because it's so charming to me. When I was volunteering for Community Action House, Community Kitchen during the pandemic, and he came in to get some food, and we chatted for a little bit because as I mentioned, I'd known him for quite some time, and he just, he was kind of done chatting, and he said, well, I guess I need to get home. And it was just so heartwarming to hear him say that he needed to get home. And that just, did my heart good. And I know that it was, the collaboration of all those people around the table that really allowed him to find a place where he could feel safe and secure. So those are the stories that the LHA organizations are telling every single day. And that's the work they're doing.
Yeah, thank you. Thank you for that example of collaboration. And I am excited for next week's conversation, where we get to hear a little bit more about how that collaboration amongst different organizations really plays out. And kind of that, just to, not to toot your horn, Lynn, but just to say that LHA really, as serving kind of that overarching sort of fostering that collaboration versus just cooperation is really so important. And I appreciate kind of that sharing of that story for us to think a little bit about that difference, right? That it's not about just simply all knowing what your piece of the puzzle is, but collaborating to make sure that everyone's needs are met. And that's such a big difference that I've seen kind of in our community really be elevated. Esther, do we have any sort of questions in the chat box that we would want to answer?
So let me pull this back. I think we addressed if there were if there were any current gaps in the LHA that need to be filled. I think you covered that, Lynn.
I did mention one. I'm sure I think so. Certainly the path for people with high barriers. I probably should also mention that more permanent supportive housing would be very valuable. And permanent supportive housing is housing that is available to people who are homeless and have a disability, a long-term disability, and will likely not be able to maintain any outside employment, but certainly need to have housing too. So I would say permanent supportive housing is an additional gap. More permanent supportive housing, we have some.
Another question, Lynn. You mentioned that there were individuals supporting services for those who have been placed into permanent housing. What kind of services are provided in those circumstances?
Well, really the Housing First model allows for people to allows us to move people into permanent housing as quickly as possible and surrounding them with supportive services that they need. So really and they have indicated a need for. So it's not about creating a housing plan or housing stability plan that we're guiding. It's what the individual has indicated as a need. And really key to that is maintaining that connection to the household, so that when a need arises or when an individual says, you know what, I'm experiencing, I've relapsed into my substance abuse. What do I do? The case manager will step in and provide some resources, relationships with, and making sure that they're maintaining relationships with their landlords.
Another question, I'm sorry, did I interrupt?
No, go ahead.
Another question that came up was, what are long-term initiatives by the City of Holland that affect cost and availability of housing? I don't think that necessarily that the City of Holland controls, that's a market cost, not necessarily the city determining.
I'm going to write that one down. Could you save that one, Esther?
Yes, I will.
That offline. That would be great.
Another one is you talked about more permanent supportive housing that's needed. How does a community member support that? Like, do you call state legislators? How do you do this? Do you tell City Hall?
Well, one of the things that could provide, yeah, that's a really great question too. Yeah, I'm gonna, yeah, because of what my initial response would be to advocate for more funding for permanent supportive housing through the state and federal government. So it would be an opportunity to communicate with your legislators about that. In particular, we are looking to expand the housing choice voucher program, which is not necessarily permanent supportive housing, but it does provide long-term lifetime housing if needed for people who need that kind of rental support. So right now, Ottawa County has 391 housing choice vouchers that are dedicated to people who have experienced homelessness, and they're all leased up, and there are 88 people on our waiting list. So we clearly could use more rental assistance, long-term vouchers, and all of that can be advocated for at the state and federal level.
So that, to me, that seems like it would be wise to reach out to your local state legislators, send a note, ask them, what are you doing to support housing, our homeless community, and just housing opportunity within our county.
Yeah, and I'd also like to mention, I meant to add this to my last slide. We also, the United Way has a text alert, and you can text advocate, I think it's advocate, to 50503, and you'll be added to a mailing list for advocacy opportunities that we send out to our mailing list for, you know, opportunities to advocate for more housing and more homeless services.
Can you repeat
Esther,
that
could
again,
we
Lynn?
maybe, Esther, could we maybe add that to the follow-up email? For
Yes,
individuals?
yes, that would be great, because I'm not entirely certain about the advocate, but I know it's 50503. I just can't remember what the word was. So.
Yeah.
Sounds good.
Are there any other questions, Esther, that are
No.
coming in at this point?
That is the very end.
Okay.
Lynn, can you talk a little bit, you mentioned that you have LHA meetings. Are these meetings open to the public, or who can attend, and when are they?
Yes, and maybe you could add that to your follow-up. We have bi-monthly meetings the first Friday of every even month at 12 o'clock. And right now we're meeting by Zoom, so it makes it easy for people to join. And if you're interested, I would say, once you have my contact information, just shoot me an email and I can add you to I have 2 email lists, and one is anybody who wants to get our minutes, receive that and receive the link to our regular meetings. So yes, we certainly welcome anyone and everyone to join those meetings.
Thank you.
I don't see any other questions. Feel free to put your question in the chat box if you have one. It is 12:52. We're close to the 1 o'clock timeline, which we want to make sure that everyone stays on their lunch hour schedule. Thank you so much for coming today. On behalf of the Human Relations Commission, I want to thank you for your interest. Please join us next week. Next week, we'll have our community partners talking about the services that they offer and how they meet the needs in the community. I think it'll be very interesting. And also, oftentimes, we don't necessarily know all of the resources that are happening. So it's a wonderful opportunity to meet with everyone that has housing initiatives and are working hard to fight homelessness.
Yeah, and please feel free to visit the LHA page at the ottawaunitedway.org website. There you'll see a list of the LHA agencies, and most of them have hyperlinks, so you can visit their page. You can see you can see housing data. You can see some of the documents. All of our applications for our state and federal grants are listed there, so you can see lots of detail about the work of the LHA. Yeah.
Thank you everyone for joining us, and we'll hopefully see you all next week.
Thank you.
Thank you. Thank you all. If we didn't get to your question, we will be responding to it. Lynn and Rebecca, if you could stay on.
Sure.
And can you take your presentation off, please, Lynn?
Yeah.
Thank you. Because I want to.
Then Esther, why don't you stop the recording as well?